All right. Hello, everyone, and welcome. Thank you so much for joining us today. My name is Emily, and I'm the Marketing Director for Clinkscales Elder Law Practice. We are a firm with main offices in Hays and Wichita, and we serve clients everywhere in between. And we really focus on helping clients answer questions and issues regarding aging, chronic illnesses, long-term disabilities, and more. And we are very excited to bring you this fourth and final session today, If the Diagnosis is Dementia. Please feel free to send any questions you may have to us in the chat box that's located at the bottom of your screen. And at the very end of this presentation, we will address any of those questions that you may have. So without further ado, I would like to introduce Nikki. She's with KU Med's Outreach Office in Hays, and she's going to be handling your portals and CEU credits. Thanks for joining us today, Nikki.
Emily. Hi, everyone. Welcome to today's session. As Emily said, my name is Nikki Cooper. I'm with the KU Medical Center Outreach Office here in Hays, and I will be assisting with anything related to the CEUs today. So if you have any questions throughout the webinar, please feel free to find the chat feature of Zoom and message me, and I can get your questions answered. So the first thing I want to start off with today is there is a way to sign into today's session virtually. In order to sign into today's activity and receive credits, you must enter what we call an activity code in prior to the deadline. And Randy, if you could navigate, I think it's slide 4. The activity code is in the handouts for today. It's also going to be up on the screen here shortly. It's 75PIMP. I don't make up those codes, just kind of randomly came up that way. There are many ways to enter this code in. There are 3 different ways to enter it on the screen right now. You can text the code to the number on the screen. You can visit www.eads.com and enter the code in that way. You can also scan the QR code on the screen if you're familiar with that. EADS also does have an app, so if you have the app downloaded, you can do it that way as well. This code will expire tomorrow at 12 p.m., so you have 24 hours for the code in. And like I said, this code is important because it actually signs you into today's activity and it gives you credit for today's activity. And even if you're not wanting to receive CEUs, we still ask that you enter the code in because this is our version of the sign-in roster. I would also like to mention that all of the handout materials for today's session are available in your EADS portal. The way you can access those is you can visit eads.com and log into your account and access those handouts at any time. And this code will be in those handouts as well, so you can refer to that if you need to again. I will also be putting the code in the chat box feature of Zoom. That way you can refer to it at any point during today's presentation. So once you've entered the code in, it will lead you to complete the evaluation for today's session. The evaluation is required in order to receive credit, and we'd like to have all of your feedback for today's session as well. So complete that, and that would be very helpful on our end. That evaluation will expire on October 21st, so you have quite a while to fill that out. After this time, the evaluation will be closed, and once you have entered the activity code in and completed the evaluation, you will have full access to your CE certificate online. Just again, log into your eads.com profile, and all of that information is in there. And again, if you need to reach out to me at any point during today, feel free to chat me in the chat box. I will be putting my email in the chat box as well, so if you need to reach out to me after today, you can do that as well. So without further ado, I will go ahead and introduce our 2 speakers today. Our first speaker is Randy Clinkscales. Randy founded Clinkscales Elder Law Practice in 1985. He is a 1980 graduate of Washburn Law School and has represented clients at the administrative, county, state, and federal levels in his 40+ years of practice. In 2004, Clinkscales Elder Law Practice began its elder-centered practice, which focuses on issues facing our aging population as well as the caregivers for those who are aging. Our second speaker today is Denise Vann. Denise is a 2015 graduate of the University of Phoenix with a bachelor's in healthcare administration. Right after graduation in 2015, she joined the Alzheimer's Association in Wichita. She has many roles in this position, including leading and organizing Alzheimer's support group facilitators throughout 68 counties in Kansas. She organizing and assisting with the Walk to End Alzheimer's in 2 communities in Western Kansas. and also provides education and outreach opportunities in all of the 68 counties in her area. She has over 20 years of experience in long-term care with an emphasis in dementia care. Let's welcome Randy and Denise.
Nikki, thank you very much. Before we get started, a couple of things. It's really important to us that you fill out the survey. We really want to know what you think about the program that we've done, this 4 months with Randy series. We tried a little different format in the sense that we offer CEUs, and I wanted to thank Nikki for showing us how to do that, and for some of you that's real important, and others you just really want the information. So we're still learning a lot. Another thing that I learned is not to wear this crazy shirt, because apparently it's making my camera kind of go crazy because of all the squares or something. So anyways, another lesson learned. And I also want to thank Denise. Denise and I have worked together putting together this program and another program like it. I've learned a lot of things about her and about dementia along the way. And Denise, just real short, quickly, how long have you been with the Alzheimer's Association?
I've been with them since January of 2015.
Okay. And so just before I kind of get to your presentation, these are our objectives, and as Nikki said, we're going to be giving you a lot of information here. You can print these slides off. Some of these are really, really helpful as you go along. But one of the things a little bit of background about our firm is that we focus on elder law. Our primary focus in elder law is actually on Alzheimer's and something called life care planning. But I thought that I would share with you this slide because for me, and Denise is going to talk about the stages of dementia. One of the things that we like to do with our clients is talk about where they are on this chart and then what type of resources they have in terms of money and long-term care insurance and like that, what benefits might be available. Are they trying to, on the home sweet home, where they're trying to get, where they're trying to keep their loved one. And we're going to talk about some options there, but a lot of times what we find is that by helping them find resources such as Denise, we actually can stay in a much less restrictive environment by finding resources like long-term care insurance or tapping into that, or VA benefits. We can help them stay in an environment that is safer or least restrictive. Sometimes it's helping them maybe if they can't stay at home, move to assisted living or Home Plus, and how to pay for that. But I think it's a really good, we get a lot of clients that complement this chart, and it helps them visualize kind of where they are, which Nikki kind of leads into what I'd like for you to share is, this slide here is what is dementia?
So thank you, Randy, for, allowing me to partner with you to do this presentation. I mean, it's always nice to have, I know you said that I'm a resource for you, but you are a resource for me as well, because that is caregivers are like, I don't know what to do. I have a lawyer that can help you. So that's one of the things that I enjoy doing. So when you think about the word dementia, it really just means problems with thinking, memory, and behavior. It is an umbrella word, and it affects people much differently. If you've met one person with Alzheimer's or dementia, you have only met one. but it does often cause changes in memory, language, their ability to form words, their thought process, their navigation. When I say navigation, that could be them driving, or that could be them simply walking across the living room and not knowing to not run into the coffee table, but rather move around the coffee table. It affects behaviors. It affects personality and mood. And it definitely affects their ability to plan and organize. Most people plan ahead. People with Alzheimer's are not able to do that. So when you hear the word dementia, which means problems with thinking, memory, and behavior, it's an umbrella word, kind of like the word cancer. Cancer is an umbrella word, and underneath that falls many different kinds. These are the most common forms that we see at the association, where you may have a mixed dementia, which might be a mix between a vascular dementia and Alzheimer's. You have frontal temporal dementia, which affects the behavioral part of the brain, our inhibitions, our ability to navigate, our ability to communicate. It affects people much younger. Where you have vascular dementia. Vascular dementia is often associated with strokes. Then you have Lewy body disease. Lewy body is often associated with the Parkinson's. So you're not only dealing with the mental stuff, but you have the physical stuff. The most common form of dementia is Alzheimer's, and the biggest risk factor for it is our age.
And Denise, before we go on, I guess I want to share something with you. Is why are Denise and I doing this with a bunch of healthcare professionals? And again, I think it's from two sides. One is that you're going to be working with patients as well as caregivers that are dealing with dementia. And being able to explain or give them some tools is so important.
Yes.
And so we're not trying to insult your intelligence at all. We're just trying to give you some tools. And again, I deal with dementia a lot. Mm-hmm. But I will tell you that in working with the Alzheimer's Association and Denise, and going through some dementia training, I have picked up a lot of tools that I feel like make it better for me to be able to not only communicate somebody with dementia, but also to communicate somebody who is caring for someone with dementia.
Yes, absolutely.
So again, I just kind of wanted to lay the groundwork there. We're really trying to help you in helping people with dementia, but also maybe giving you a better understanding about what the dementia is. Some of you are, because of your role as a nurse or a CNA or whatever, are caregivers. And some of the things we're going to talk about, caregiver burnout, really apply to you as well as to family members.
So one of the things that a lot of people don't know, and I like to share it, is right now in Kansas alone, there's over 55,000 Kansans over the age of 65 who are diagnosed with Alzheimer's. It's estimated by 2025 that 62,000 Kansans, because someone is diagnosed every 65 seconds. And by the year 2050, every 33 seconds. It is the 6th leading cause of death in the United States and kills more people than breast cancer and prostate cancer combined. And the thing of it is, most doctors will not tell their patient that they have Alzheimer's. Only 45% of the doctors will tell them they have Alzheimer's. The other will tell them that they have cancer. So it is something that's almost, there's the stigma around it, but it's important. And one of the reasons that, Randy and I are doing this is because it's okay to talk about it. Knowledge is power. When we're trying to help our clients or person we're caring for, even the caregivers who are caring for somebody. So knowledge is very much power. So.
Before you get into this, there's a chat box, and I would just like to ask the audience, how many of you have undergone dementia training? And if you would, go to the chat box and put Y for yes or N for no. And so, Denise, while we're waiting on that, I'm going to have you go ahead.
Okay. So at the Alzheimer's Association, we really recognize 3 stages of Alzheimer's, where we have the early stage. They're just diagnosed. They're still able to participate in their lives. They're making their own decisions, and they should. A diagnosis of dementia doesn't mean that you don't know what you're doing and that you can't make decisions, because you very much need to be a part of your future planning. They are able to express needs and share coping strategies. They have a clear understanding of what you're saying to them, so there's no need to raise your voice. I had, in my years of long-term care, I had many patients that would say, "I'm not deaf. You don't need to raise your voice." So I had to step back and kind of think about that. They want to engage. They want to continue to do the things that they've always done. And I'll give you a story really quick while we're waiting on these to come in. I had a man who was diagnosed, and he was a pastor of a church. And he did not want that to be hanging over his head. So he went up in front of his congregation and he said, "I have been diagnosed with Alzheimer's. I want to continue to provide the sermon every Sunday for as long as I can." And he said it was amazing how much that church embraced him. So there's no stigma on it. And in the early stage, they're very much independent with their activities of daily living. They can still they might need a little bit of help with here and there, but they're still able to do it. The early stage usually lasts 2 to 4 years. When you get...
Let me just quickly. Emily, any poll results?
It looks like 80% have had some type of training.
Great.
Perfect.
Great.
That's what the Alzheimer's Association likes to hear. That the people that are working in the long-term care, whatnot, they have taken that training. So that's great. I'm glad that you did that poll, Randy. So when you get to the middle stage, which is the longest stage of this disease, it's average 2 to 10 years. Like you said, if you've met one person, you've only met one. There's lots of things that can complicate this disease. But in the middle stage, they may forget to eat or drink. They may confuse fiction with reality. And it's so important that we meet them where they are. They may ask the same questions over and over again. I've had many a caregiver that said, if they ask me that question one more time, and but they honestly, they don't know that they're asking it. It just becomes a movie reel that pops in their head. They ask the question and then they move on. Middle stage is also where you might see behavior changes like aggression, agitation, being suspicion, hallucinations. It's important that we break things down into basic tasks. And I use the example of tying our shoes. We just tie our shoes, but it's actually a series of events. First, you have to find your shoes. Where's your left foot? Where's your right foot? What was I doing? It's something that we just often will just do. But for somebody with Alzheimer's and dementia in the early stage, it's almost like climbing Mount Everest. They may become unsafe to stay home alone. They may wander. They may have sleep disturbances, up for 3 days, down for 3 days. But then they will need assistance with ADL. Not to say that you have to dress them, but you may need to give them 1 or 2 choices: the pink shirt, the blue shirt.
Yeah, I think the slippery slope for many of us is between the early stage and the middle stage.
Yeah.
And understanding where that person is. One of the things that, Denise, I've shared with you is many times the person with dementia may come into our meeting, and I have to remind the family that they are in the room. And we need to talk as if they're in the room, and respect their ability to understand to the extent that they can.
Mhm.
One of the questions I know comes up a lot, and I'm going to ask you to, Emily, poll this again. Can a person with dementia make a power of attorney? Y for yes and N for no. And then we'll come back to that a little bit later. But I do want to know what the feelings are. So can a person with dementia make a power of attorney? Yes or no? All right. You ready for the later?
I'm ready for the next one. And so when we get into the late stage, they will have limited movement, may not be able to reposition. They do become 100% dependent on their caregivers. They are 100% incontinent. They may not be able to recognize loved ones. We often, when we talk about communicating with them, instead of calling them mom, we might call them by their preferred name. They may not know who he or she is, so stay away from pronouns. Need assistance with eating and drinking. They still very much have feelings. They can respond. For instance, my grandma, when she was in the later stages of it, we talked about how she never made us go. She'd always let us sleep, next to her. All the fun things she used to do. And she would sit and she would look over and she would smile. They still very much have feelings. They're just not as pronounced as you would see in the early or middle stage. And they are totally dependent with their ADLs. And the average is 1 to 3 years for the late stage. But like I said, a lot of things can complicate this.
So, Emily, what was the poll result to my very unfair question?
There was one yes, and then a few others that said that it might depend on what stage they are in.
Exactly.
Exactly.
And that's a really good point. In that, and we'll talk about this a little bit more. It's really it can be not only the stage, it can be the time of day.
Mm-hmm.
Certainly, when you get into stage 3, most likely there's not going to be moments of clarity.
Mm-hmm.
But stage 1 and 2, we can have some moments of clarity. And I'll talk about that a little bit more when we get to the legal stuff. But so some of you corrected my really bad answer, my really question. So Denise, I want to talk a little bit about caregiver tips, and this first one again that I like is you can't pour from an empty cup. And I know in our office, one of the first things that we talk about with the caregiver is what is their support system, and
Right.
if they're doing it. I come from an area of the country with a lot of really hard-headed Germans, and I'm married to one of them, so I can see that. But they try to do it on their own. And a 70 or 80-year-old woman trying to take care of her 70 or 80-year-old man, husband, and she's just exhausted, and they both moved into the living room because he keeps getting up and she needs to hear him, and he gets in the recliner and so on. So, it's almost to the point where she's in physically more of a worse shape than he is physically. So.
Yeah, one thing I would add is caregiver stress is a very real thing. And a lot of times, because we think nobody can take care of our loved one like we can, we tend to take it all on. Because I did the same thing with my grandma. But you can't, pour from an empty cup. So if you don't have anything going on for yourself, you cannot help your loved one. So it's very important they take care of themselves.
And I read a statistic quite a while back, but something along the lines that 60% of family caregivers die first,
Yes.
which is really frightening. Caregiver tip 2, give your love and your relationship love and attention. And let me just tell you what I'm trying to reference there is that many times what will happen is that you lose your relationship with the person you're caring for, and you become just a caregiver, and you lose the role as a spouse or as a child, and you need to be able to step back and honor your relationship with the person that you're taking care of. Watch for signs of stress. Denise, I'm sure you could.
So yeah, some signs of stress might be, losing weight, not eat, because you're not eating, because you're worried about your loved one, not sleeping, so you're very tired, making mistakes. It's important as the caregiver or the people to kind of keep an eye on that caregiver, because they may not know they're stressed out. It just might be their norm, but they have to take care of themselves, or they're not going to be able to take care of their loved one.
And I've got denial, anger, social withdrawal, anxiety, depression, exhaustion, sleeplessness, irritability. Certainly, social withdrawal, lack of concentration,
Mm-hmm.
A big one for the caregiver, a new or exacerbated health problems. So all of those are good signs that we've got caregiver burnout. How to combat stress. Denise, you want to talk about that?
So what I would say is, if you have any way of taking a break from the caregiving, then do that. Whether that's you having a friend come over and hang out with your loved one, and you just go for a walk or go get your hair done. It's important. The way that we tell our caregivers to combat stress is take that time for yourself, because taking care of somebody with Alzheimer's is a 36-hour day. Caregivers don't get that break. So it just becomes very, very stressful, the constant. So I would say take that break.
So, and I think this is a big one that Denise has really helped me with, but it's really a tool to help combat stress as well. And so that, because I think the one stressful thing, almost more than anything with dementia, is communication, or lack of communication. And it's that, again, that repetitive question or whatever. So let's talk about this, Denise, caregiver tip 5, about communication.
So when you communicate with somebody with dementia, or if you communicate with anyone, 7% of how you communicate is verbal, 38% is your pitch and your tone, and 55% is your body language. Body language with this disease speaks volumes. So one of the things that we try to tell people is, when you're in that a situation with your loved one, don't argue. Instead, agree. Rather than reason, try to divert change them to something else. Don't tell them, well, Mom, I know you did this yesterday. How come you can't do it today? Rather encourage or distract. Try not to lecture. Instead, reassure. Avoid saying the word remember, because they don't remember. Rather than saying, don't you remember? And you're trying to find out if they had breakfast, you might say, I love bacon and eggs. Oh, I love the smell of bacon. So you start talking about it, and they may go, me too. And so it strikes a conversation without you actually confronting them. Don't say, I told you. Say what you want to say. The thing of it is when you're communicating with somebody with dementia, you need to ask for what you want and say exactly what you mean. The subtlety in the middle that we often use in our language, they cannot pick up on that. So ask for what you want, say exactly what you mean, encourage them. Try not to command or demand, getting the word you out of there, rather using the word we. Can we go? Can we go? Rather than saying you need to go, which, we say that. And I know my husband says I'm a bossy female, but we can't, we have to use the words we. Don't condescend instead of them, and praise them. Oh my gosh, you're doing such a good job. Don't enforce, instead reinforce. Know the person better than the disease. And when I'm talking to the professionals and, on this call today, go to the activity assessment, go to the social history. These are all assessments that are done in long-term care right when they, as you well know, right when they come in. Find out who, when, what, when, why and how. Who do they like? What do they like? Those kind of things. It's going to help you to connect with them later on in this disease.
And I'd add one that I just thought of as I was sitting here is eliminate steps. And
Yes.
what I mean by that, don't tell them 3 things to do.
No.
That really becomes challenging. And so the simpler your instructions,
Mm-hmm.
the simpler the reinforcement, the better it's
Mm-hmm.
more chance of success. So help others help you. And I have some real opinion about this, but Denise, anything you want to say about it?
I want people to know that there's no shame in your game. It's important that you ask for help. There's no I in team. And a lot of caregivers or even people in long-term care tend to, have favorites. I know we're not supposed to have favorites, but it always happens. So, ask for help. Help others help you. Giving them tasks. At the Alzheimer's Association, there's on the website, it's called an calendar, where caregivers can go in and say, I can come on this day, or I can come on this day. And it's just a schedule, and that gives that caregiver a break. But that would be what I would add to that.
And so one thing, I wrote an article, a few months ago. One of the things I think that is important is that you get in the middle of this, or a caregiver gets in the middle of this. And then, again, type of people that I deal with a lot. And then somebody comes up and says, is there anything I can do to help?
Mm-hmm.
Write that person's name down.
True.
And then when you think of something, then you can go to that person and say, I need to run to the store. Can you come watch John for an hour or something like that? I understand it is difficult I'm one of those people. It's difficult for me to accept help.
Mm-hmm.
But having a pool of people that have volunteered to help you creates a lot of options, and it doesn't throw all the burden on one person, and it gets rid of your guilt because you know that there is someone out there that's willing to step up. So again, just don't blow those off. So if you're working with a caregiver, remind the caregiver of that. And I keep saying it's the woman taking care of the man. Statistically, most likely, it's going to be a woman with dementia.
Mm-hmm.
Statistically, women get it, according to the Alzheimer's report that I just reviewed a few days ago.
We are at the epicenter of diagnosis. We live longer than men, and the biggest risk factor for getting Alzheimer's is your age.
Okay, so talk about some care options here. And again, if I went back to that chart I showed you at the beginning, We would be talking with families about this. One of the things, Denise, I'm seeing pop up are the Home Plus. We've got one in Hayes that we've been really happy with. And again, it came out wrong, but they've done a really nice job with our clients with dementia. We've got some in the Wichita area that have been really satisfied. We have assisted living facilities that have special trained staff that do a great job with dementia. And again, the whole variety of I don't mean to focus on them, but it's just interesting how this is developing. Anything you want to add to this?
No, they are very popular in the Wichita and surrounding area, the Home Pluses. They're just an alternative to a long-term care facility. They're providing all of the same care that a long-term care facility would, but just a smaller environment, and they are becoming very popular.
One thing I was sharing, I think maybe Denise watched it several weeks ago, I interviewed with some other attorneys, Leroy Van Hall, who is the originator of the Dementia Village in the Netherlands. And that's a community where everybody everybody's got a single room or even a single building, but there are restaurants, there are clothing stores, there's money, there's a bar, and so forth. But it's all for people with dementia, and they're free to roam in this community. There's a gentleman by the name of Dr. Jim Wright, who is actually expanding the concept in Virginia, and will actually is set up so there is more of an interplay with the public and the Dementia Village. So there's some really exciting things about it. I think the struggle has been, frankly, with the funding model and how do we pay for it. And as many of you are aware, a person with dementia requires different care than a person with a chronic illness, such as an aging issue or the like. So again, working with Denise, working with our office or whatever, we're trying to find the appropriate living opportunities for somebody with dementia.
Excuse me.
So just professionals to contact the Alzheimer's Association, and I'm going to give you a number. The area agency, I know one of the things that came up, Denise, I was on the Kansas Alzheimer's Task Force, was the difficulty in accessing neurologists and neuropsychologists across the state because of distance, because of scheduling and so forth, but that can be a real important tool.
Yeah.
I'm going to talk about legal stuff now. Probably the most important thing for me is to be sure we have decision makers so that when the person cannot make a decision, that there's someone that's willing and able to do that. Because if we don't, then we have to go to court. And so, we have several options. It could be a family member or a friend. And again, where do you fit? You as a healthcare professional, where do you fit? You fit in trying to urge the family to do this. What I was sharing with Denise is so many times families come to me and they may be at mid or late stage, and they are deer in the headlights,
Mm-hmm.
and they have nobody does dementia training proactively before there's dementia. I mean, no individual. I mean, healthcare professionals do, but so encourage them to find a family member or a friend. You know, we do run into a lot of what we call elder orphans that don't have a family member. I know we've used church ministers, somebody from the congregation. You can do professional decision makers. There's some drawbacks to that. Sometimes we have multiple decision makers. Again, there's some drawback to that, but at least I would like the person with dementia to make a decision about who they want their decision maker to be. And so to go back to my poorly worded question, if I have a client that comes into my office and they have dementia, if I feel like they know who they are, who their family is, what their property is, and how they want it managed in broad terms, then for me, and under Kansas law, that's enough to do a power of attorney. And so I may go ahead and do that power of attorney. Now sometimes, and I have to do it early in the meeting, Denise, because if my meeting is 2 hours long with a client, I've probably lost the person with dementia. That's too long a meeting for many people with dementia. So really two types of powers of attorneys. One is financial, and that's to make, again, business financial decisions. And one is for personal and health care. And financial is one that I really is important to me because I can help that family protect assets. I can tie them into resources that are out there helpful. But the other one that is really important to me is before I get into the healthcare. In Kansas, unfortunately, our statute is set up where there's 15 optional powers. And unless that person opts into those powers of attorney, to those optional powers, they're excluded. And it's not necessarily they're good or bad powers, but when we have somebody with dementia or a chronic illness, we like that power of attorney to be really, really aggressive, particularly if they're married, because we need to protect the spouse, or we need to, deal with Vanguard or banks or whatever that can be really obstinate in trying to get things done. And so I know our power of attorney now is about 20-something pages. So, it's grown over time as we learn from a lot of other people's mistakes. And so we correct those in our powers of attorneys. But I want to talk to you a little bit about a healthcare power of attorney, because contrary to what people think, under Kansas, nobody has the right to make a healthcare or a financial decision for someone else except a minor child. So I don't have without a power of attorney, I have no ability to make healthcare or financial decisions for my spouse or my adult son or sons. It's very clear. I mean, our option is to go to court and get a guardian conservatorship. But again, I like to, for my person to decide. And again, in my case, as an example, my power of attorney for healthcare decisions after my wife is my middle son, because he's comfortable making healthcare decisions. He's a nurse, and he could pull the plug if I needed him to. I also put in there in my healthcare power of attorney, Denise, a bunch of dementia language. That if I have dementia, these are services I don't want anymore, and I list those. I list what medications I don't want. So you can get real specific. The next two slides, this slide is fairly important, and I would probably recommend printing this slide out, because I get asked this a lot. who can make a power of attorney, who can make a healthcare power of attorney, who can make a declaration, and who can do a DNR. And so this is a really nice little tool to have if you work in a facility and you're wondering who can do that. So just I won't go through all of this, but again, I would print off this slide and keep it handy. Denise, before I go on to other documents, anything you want to talk about on the powers of attorneys?
No, I have actually learned something though. That and I knew this, but you just kind of confirmed it with me that if something happened to my husband, I can't go in and make decisions for him unless I have durable power of attorney. Is that correct?
Okay.
Right. Correct me if I'm wrong, but years and years and years ago, that wasn't the case. You could make decisions for your spouse, right?
Yeah, it's kind of weird, Denise.
Mm-hmm, yeah.
We're one of 4 states where that's true.
So, and a lot of the caregivers that come into our office or whatever, they come to us in the 11th hour, where they haven't thought about that kind of stuff. So, I think the fact that we have an elder law attorney, which you are on our list of attorneys that we can refer to, I think it's great that you have this broke down and that the healthcare professionals will get copies of this. So, I really don't have anything else to add with that, but.
And again, this is probably another slide that you might want to print out. There are actually 2 DNRs. There's one that's a directive that's just signed by the patient, and there's actually one that's an order. And a patient has an absolute right to sign a directive, regardless of their health. There's a famous Kansas case where a prisoner at El Dorado wanted to sign a directive, and he was perfectly healthy, and they would not let him sign one under the belief that he just wanted to die so he could get out of prison early.
Wow.
That was the argument, and it went to the Kansas Supreme Court, and the Kansas Supreme Court said you have an absolute right to deny health services.
Yeah.
Anyway, I just thought that was kind of interesting. I want to touch on just a couple more. Some people have a last will and testament. One thing I want to point out to you, I hear this a lot. I have a will, so I don't have to do a probate. If you have a will, you have to do a probate. Okay? It's the opposite of what you believe. For a will to become effective, 2 things have to die. 2 things have to happen. Number 1, you have to die. And number 2, somebody has to take it to court. So if there's anything that needs to go through the probate process to be transferred, it's going to have to go through a probate. So just because you said it in a will doesn't mean it's going to happen. The other thing that typically that we do is that if we have somebody that's in the nursing home, we generally don't want to leave that person property, because then it's going to just be spent down. Now, sometimes that's what the family wants, and I respect that completely. But many times they don't want to do that. So many times we're going to change the estate plan of the well person. Just talk about trust for a moment. We use those to avoid probate. There are certain types of trusts that can protect property from liability, from long-term care costs and the like. But there may be Medicaid issues, VA issues. So talk about, Denise, anything you want to add there, questions you had there?
No, the slide before that one, I do have a question about that. The I love you will versus I love you but will. Can you explain that a little bit more?
Yeah, so the typical will says, honey, I love you and I'm leaving you everything. Okay?
Mm-hmm.
the I love you but will says, honey, I love you, but I'm not going to leave you everything because you're in a nursing home.
Okay.
Or because you have dementia, or you've got, so I want to, without getting into a client, I have a client who's a very, a businessman. His wife developed dementia prior to turning 60, several years before turning 60. And he really doesn't want to leave her everything. And in fact, what he leaves her, he wants to put into a special type of trust that somebody could manage for her. So we certainly want to change that in light of her dementia.
Well, that makes sense.
Okay.
Thank you.
Paying for care, that's always, again, a lot of you are going to know this. In-home care, $20+ an hour. Have a client that's paying for 24/7 care at $24 an hour. I think around $3,200 a week is what he's paying for in-home care. Assisted living, again, that's kind of where we are around here. Nursing homes are $7,000 to $10,000. And Denise, down in Wichita, I know that you guys have even higher numbers than this. So
We do.
payer options, Medicare, and a lot of that can be advocacy. Getting Medicare to pay longer for skilled care or whatever. I don't want to say manipulating the system, but understanding the system and stretching it out as long as possible. Health insurance is certainly not going to pay for in-home care, nursing home care, but a lot of times they can help cover the doctor bills and the medications and that sort of thing. Long-term care insurance, I'm going to talk about that in a minute. Private resources, we work with our families on which resources to use. Sometimes, and I think I've got a slide, in fact, I'm sure I've got a slide on this. Again, this is kind of what Medicare covers, not custodial care, but again, we can, people, there's some exceptions right now going on to Medicare that would allow for transition to a nursing home for somebody that has COVID and dementia, and Medicare will pay for that. And so be aware of, there's some special COVID rules right now that would expand Medicare coverage. Other payer options, health insurance generally no. Life insurance, sometimes we can actually sell a life insurance policy through something called life care funding and pull the money out of it and use that to pay for care. And we've done that quite a few times. We've talked about private resources. That's just setting aside how to pay for the care. I do want to talk to you about this because I think this is really important. So typically what we will hear is, I have long-term care insurance and that will pay for my care. Understand that long-term care policies are all written differently. And it's really important, if you're helping a family file a claim, to look at the policy and look at what has to be complied with in order to get coverage. So what I'm telling you is, read the words in the policy. VA pension, again, I know I'm running out of time here, and Emily's going to start barking at me here in a minute. But again, for a wartime veteran, they can get up to $2,200 a month. A widow, $1,200. There's some limits on assets and income, but it's a great benefit. We probably have 70 or 80 clients that receive some type of pension. So Medicaid, a lot of you have dealt with that. We try to help our clients avoid it, but Many times we can't. What we have found that, you know, we had a family in last week and they knew Dad was going to need to apply for Medicaid, so they transferred all of his assets away. That,
Oh, no.
yeah, yeah. And so that, and you know, just a misunderstanding about what they needed to do. And so just to make the family aware that there is Medicaid out there, it will provide coverage, but there are some strict rules about what you have to comply with. And we have 2 people in our office that do nothing but Medicaid. We talked about the VA benefits a little bit. Again, Medicaid rules. There are some ways to transfer away property without running into Medicaid problems. So I ran into a case last week, the week before, where a gentleman had been taking care of his dad for 9 years. And there's a caregiver exception that allowed us to transfer the home from dad to the son without any type of penalty. So again, and you can transfer property to disabled children. And again, there's a lot of rules about that, but it's a good option to help families. So the takeaway here is I just urge your patients and to take charge and get smart about the situation. Just a couple things here. Learn to become a skilled dementia caregiver. I'll give you a heads up in the Alzheimer's Task Force report. There is some language in there that would move us toward requiring dementia training for facilities that provide for dementia care. Now, we're probably a long way off from that, but I do want you to know that that is in that report. And then urge families to take steps to protect themselves legally. Again, I guess what I wanted you to take away from this was understanding types of dementia, that caregivers, professionals, and family members need tools, and that legal planning is important. We do have 3 people on our staff that are trained in dementia, a nurse and 2 social workers. So we work with a lot of families. But again, we help them tie into Denise and other resources like that. Here is contact information for the Alzheimer's Association and for our office. And I don't know if there's any questions, Emily, at this point?
No, it does not look like there's any questions right now, but I would encourage everyone to please ask those in the chat box right now at this time, kind of while we're doing our closing, in case you have any last minute remarks or questions for Denise or Randy. But while we're waiting on that, we can kind of go ahead and wrap up a little bit here. And I just want to remind you to please be on the lookout for that follow-up email from us here at Clinkscales. Randy did mention that the email includes a survey link asking you to give us some feedback on these sessions, asking if you'd like any additional resources that we can send to you. That could be from us or from Denise or any of our other speakers for that matter. The email will also include a recorded video of this presentation, so you can refer back to it or share it with others, but just remember that the recorded sessions can't be used to attain those CEUs. So lastly, we just want to mention again how much we appreciate your attendance today, and want to encourage everyone to sign up for our geriatric symposium. It's next Thursday and Friday, and it will be held virtually via Zoom as well. And we have some truly great speakers that we can't wait to share with you. And you'll also be able to receive CEUs for your time in those sessions as well. So please visit our website at clinkscaleslaw.com/events to register, or you can just call us for more information and we can get you that registration information and get you all set up and ready to go. So lastly, oh, go ahead.
Well, I just wanted Denise Denise, you've got some training.
Yes.
And
I have, tomorrow we are hosting a COVID-19 and caregiving with an update on the public policy here in the state of Kansas. I did put the link to register in the chat box. It's something that's a hot topic right now, you know, especially with loved ones not being able to go into the long-term care and visit their, you know, their loved one. So I would encourage you to, the professionals to sign up to see that and let your caregivers know about it. But I did put the link and everything. It's tomorrow at noon via Zoom, and the registration is in the chat box. So.
Great. Thank you, Denise. Please feel free to sign up for that, everyone. And with those last minute regards, I will go ahead and hand it over to Nikki.
Thank you, Emily. I just wanted to do a quick reminder to everyone about entering the activity code for today's session. That is required in order to receive CEUs for today's session. And even if you do not want to receive CEUs, we still ask that you enter that activity code in, because this is our version of our sign-in roster. The activity code is in the chat box, and I think Randy's navigating back to it on the PowerPoint. It is 75PIMP. And that code expires tomorrow, October 1st at noon. So you have about 23 hours to enter that in right now. Please go ahead and do that before the code expires. I did have Emily provide my email address in the chat box. So if there's any questions you might have after today's session about any of the Lunch with Randy series that happened in September, feel free to reach out to me and I can get your questions answered about any of your CEUs. Thank you, Emily.
Thanks, everyone. Thank you, Denise, and have a great rest of your day.
See you guys later.
Thanks.
Bye.
you